thank you for inviting us to chair this session on health and data, which certainly for me is a personal passion. So as well as we'll do a little bit of intro for ourselves, and then we'll talk about the structure. And so I'm the chair of the HIN, which I joined in January. Prior to that, I was an investment fund manager in technology and life sciences and public markets. But as well as the HIN, I'm on the board of the Turing Institute for AI and Data Science. I'm on the KQ Labs Health Data Accelerator. And I'm a partner at Syncona, the venture fund in cell and gene therapy, which of course King's has a company in. And I'm also a King's student. So nice to be connected to the college again. Amanda, do you want to just give us a brief intro to you, and then we'll go to the main session?
Yeah, thank you, Hitesh, and thank you to Jill and colleagues for inviting Hitesh and I to co-chair this first session. I'm Amanda Beverley, Exec Director of Digital Transformation at the Health Innovation Network, which is the academic health science network in South London. I suppose my background, having worked in probably all parts of the health NHS system at some points, is really around innovation, adoption and spread. So having sort of set up and run the NHS Innovation Accelerator for a number of years, also being on secondment to One London, and being part of the Director of Strategy and Partnerships at DataCan, Health Data Research UK Hub for Cancer. So big passion around digital data, but really about how do you get it into practice for patient population and staff benefit. Thanks, Hitesh.
Right. Thank you, Amanda. So the way we're going to do this is quite tight, but we hopefully will stick to time and we'll have time for Q&A. So we have a series of presentations from our speakers, Jill, Jonty, Beverley and Jack. We're going to spend 25 minutes going through those, and the speakers will hand over to each other. And then Amanda and I will come in for a 15-minute Q&A session, hopefully on things which emerge from that. And also we've got the chat line open, so we'll keep an eye on that as well. So on that basis, Jill, are you ready to share your screen? I think you're starting off with the first part of the presentation.
That's brilliant, Hitesh. Yeah, Isabel's going to drive the slides and I'm going to kick off. And then a number of us will speak to the slides. So next slide, please, Isabel. So just to say, the blueprint for integrating our health data science is a piece of work between KHP and the South East London ICS. It came to the KHP board in June and to the ICB in July, where it was agreed and accepted. And we have been asked to go and shape a delivery plan for this blueprint. And today is part of the socialising of this blueprint with as many stakeholders as we can. We really value your feedback, and it will go into the emerging delivery plan that we're shaping. So just to say, this is hugely important, not just because bringing the big data together is important and there is power across our scale, there is an opportunity to hear from and listen to patients, but we can also have this as part of a major integration journey that connects science, whether that's genomics, proteomics, metabolomics, connected in to the integration of our health data, totally with the aim of improving health and experience for our patients and making sure that we're the best place to live, work and learn locally. And part of the bringing this ecosystem together is really exciting. We've got potential really to develop a significant amount of work that's already underway across the system, whether that's the work across GPs and Cecil, the Population Health Catalyst, and empowering and developing our workforce. So we're just going to talk a little bit about the shape of the blueprint, and we're going to talk about some of the technical aspects of it, and then that opportunity really to work towards population health data management. Isabel, next slide, please. So the big opportunity for this is that it builds on the masses of assets that we have across South East London. So you will all be aware of the work across place and primary care networks, the ICS, etc. But the data development, whether that's discovery data science, connecting primary care data, the work that's happened initially in Lambeth, for instance, in Lambeth DataNet, and the opportunity to bring our data together and to be able to connect that to the university. But we also have other assets that we're very proud of. So that's about the development of the AI Centre, but also looking at the developments that have come out of SLAM and the Institute of Psychiatry, Psychology and Neuroscience, natural language processing through CogStack and CRIS. And then if we look at where we are with EPIC in 2 of our trusts, I know not everybody is moving forward to EPIC, but what opportunity that gives us with a massive amount of our data. And then when we look at wearables, whether we look at applications, whether we look at some of the other pilots that are underway, how we create a way for patients, for staff and for citizens to be able to connect much better to this data, and some of the really vibrant learning that we've had, whether you look at the work that Matthew Hotoff has done on Radar CNS, or whether you look at the Zoe app through COVID, etc. Next slide, please. And so there are 3 major transformation areas of the blueprint. The first one, and I'll take you through these, is to look at a series of high impact changes. So how do we bring our data together, create the use case for that data and the governance, but also to make sure that we are building on the things that matter and that we have a strong central focus on what good looks like. Transformation 2 is absolutely about the technical infrastructure, the black boxes, the wires, and how it all comes together, and that major opportunity around AI and federated learning and the algorithms that go with that. And then thirdly, transformation 3 is building on all of this to create population health data management programs so that we can have the kind of anticipatory care, anticipatory risk management that we all aspire to achieve the outcomes that we want for our patients. Next slide, please. And so that finally from me, and then I'll be handing over to Beverley. But in terms of transformation 1, we're very proud of the work that we've done with many of the teams represented on this call today. Certainly a workshop in the spring with 90 members of staff, looking at what are the 5 high impact changes that we would like to use as the litmus test to help us know what good looks like. So that's about the vital 5, and understanding how we're reducing the burden of disease across our community. The capacity to work across mind and body so that we're treating the whole person. To ensure through access and processes that we improve health equity, and that we improve population health and population health data management, but also finally that we're constantly checking and testing with ourselves that we're building in that focus around medtech and AI that we need in order to both lead the pack and to match with developments across the world. I'm now going to hand over to Beverley, who's going to take you through transformation 2.
Thanks, Jill. So hi everyone. So transformation 2 is really about the underlying architecture or the technology stack of how we're actually going to deliver this. What are the platforms going to look like? How are we actually going to turn the vision into reality? First of all, this slide really shows that where we've come from in the past is very much a siloed approach. We have had quite a lot of helpful local utility from data and data sets, but it's been done through a very narrow channel where people have been coming at this dilemma or problem to solve their own problems or their own use cases. And of course, lo and behold, when you look at the sum of all the assets we have across KHP in South East London, things they either overlap or they don't necessarily integrate with each other. Many platforms, multiple expenditure, and it's quite difficult to create this, if you like, coherent approach. Very little data is joined up between, for example, primary and secondary care, and where it is joined up, it's very, very labour intensive without any systematic approach to how we do it. So our approach, just moving forward to the next slide, is to try to create some coherence. And what this architecture is effectively trying to do, well, it will do, is build on what we've already got. We cannot afford, in this economic situation we're in, to just throw it all away and start again. Again, we do get some utility across the patch from some elements of it. So we're going to build on what we've already got rather than starting again. Jack and Reza will talk to you in a bit more detail about the secure health data environment and the data sciences centre around AI. But of course, the idea here is that we have 4 pillars of development. By having 4 pillars and not trying to boil the ocean and do everything all at once, we allow the different stakeholders to get what they need whilst architecting for a future where we can join them all up. So in other words, we're creating 4 secure data enclaves that work themselves for the component parts, as it says in the diagram, but ultimately when we're ready, we can join those all together through standardization. This is why through our EPIC implementations in the acute sector, we're insisting on the use of SNOMED CT, and we're busy building the interfaces for the data feeds so that when the other environments are ready, that data can start to flow. So it's like a parallel approach. I think that's probably enough from me. I'll hand over next, I think, to Jack.
Thanks, Beverley. I'm Jack Barker. I'm a chest physician at King's, but have also been CCO for South East London, and I work with colleagues in North East London on this, and also I've been working on the London Health Data Strategy. So this really represents the flows of data that we've agreed very recently across London, and that have been recently successfully funded as part of the subnational SDE for R&D. So we were all celebrating a week or so ago because we've had our application approved. So what Beverley and others have got people to agree is all the 5 ICSs in London are going to be contributing data to this environment. We already have access to the data processed by NHS Digital. So as Beverley says, we're building on what we've already got. And 3 of the integrated care systems are bringing together the primary care data in close to real time. And that's already producing a lot of benefits. We never had that before. So we've got quite a good foundation coming in from 3 ICSs, and the other 2 will have to start contributing this year. That will start to build this longitudinal data layer with those 2 elements, the NHSD data and the primary care data. And in due course, those other elements will come in. There are people on this call that know a lot more about it than I do, and Reza will probably talk about that. So this environment is going to be hosted by North East London ICB because they also already host the former CSUs. So they are aggregating masses of data already. And the main challenges this year are going to be more in terms of IG and processes around this data, rather than actually getting the data together for the first year. So a lot of work to do there. And if you come in from the right-hand side of this diagram at the bottom, where we get to research and development, because that's what this agreement was about, that essentially is the North West London Discover Now environment, because that's already set up as a trusted research environment. So there will be a kind of fusion in the first instance of the information coming in from the left and the existing architecture in Northwest London on the right. But as time passes, we hope that this will all fuse into one secure data environment, come trusted research environment with all data types for London. Reza.
Thank you very much. And just to mention that as part of this endeavor, we'll see this in the next slide, but you see a little box with what's called AID and FLIP. Those are some of the technologies we've developed to support AI deployment and learning. So AID stands for AI Deployment Engine, and FLIP for Federated Learning and Interoperability Platform within the London Medical Imaging AI Centre for Value-Based Healthcare, which is based actually here within South East London, which in King's College London and Guy's and St Thomas's, but actually all KHP partnered, and many other trusts across London, and actually other universities, including Imperial and UCL, are part of that. So just going on to the next slide, the AI Centre, and actually the great work that's been going on, and actually it's incorporated in part in the AI Centre, but for many years by our colleagues at the Institute of Psychiatry, Psychology, Neuroscience, and clinicians of South London and the Maudsley, really is a key underpinning, if you like, expertise that we are bringing to this cross-London activity, but also where we can really build on locally within South East London. And the key points to make here is that we've had substantial funding from UKRI, that's UK Research and Innovation, through particularly their Innovate UK arm, and from one of the key bits of the NHS to fund research and innovation to basically build this. It's been £26 million of funding to build this infrastructure for London, but we're showcasing it particularly in South East London. And that is the London AI Centre, involving multiple patient pathways. So there are 20 patient pathways. Now, the key interesting thing is this is not just about bringing the university, King's College London particularly, but the other universities as well, and the hospital trusts together, but also industry. So we have big industry partners like Siemens Healthineers, but also lots of small SME companies who are all getting access to data, getting to develop AI tools, getting to test those AI tools, and actually getting to even evaluate the clinical utility, the health economic impact of those tools within the centre. And I think that's been a real sort of plus for us in South East London to really show not just this is about learning, but also about impact on our patients. I think this activity will carry on for the next year or so, because those developments that I mentioned, the AI Deployment Engine and Federated Learning and Interoperability Platform, actually Beverley is the SRO for making that whole thing happen, are now being implemented into the NHS Trust. So in effect, this isn't just about university kit. This is actually NHS Trust having high performance computing, having software which is developed for them to be able to deliver on those things, and in partnership. And I could certainly go on more when we get to questions about how these things work, but we're hopeful now that this will also be expanded across London after the successful bid from last week. And I'm going to pass on to Jonty.
Thanks so much. And look, I'll try to be relatively brief. Hi, everyone. I'm Jonty. I work as a GP and also a joint medical director with Toby Garrood for the Integrated Care Board. I suppose just before I say something about this sort of third pillar of transformation that we're talking about here, I did just want to flag what fantastic work has gone into the collaboration that has emerged across London around the development of some of this infrastructure. I've been around a few years, as I know others have, and there are people on this call who have been instrumental in bringing about the SDE bid. And it's much more than just a bid. I think it's certainly the first time I can recall where we have seen that level of collaboration across academic and systems across London to ensure that we've got the infrastructure we need. And I can't see any way that we can develop what we need in South East London without doing it in partnership with people across London, recognising all of the pressures that there are and recognising the progress that there is in different parts of the city. So I suppose I just wanted to call out my enormous thanks to people on this call who have been working so hard to create that opportunity for South East London. And it really, really is a milestone from my point of view, and a really, really strong base on which we can build what we need for South East London. I guess the point of talking about Transformation 3, inevitably I'm kind of quite passionate about this stuff, is that we can connect up some of the data that we have and we can think about how we derive insight from that. But it's really important we make quite a fundamental shift away from this just being for, if you like, kind of niche research. It's all about now starting to shift to learning health systems, where we increasingly use data to drive everything that we do. And Richard Douglas, who I think is hopefully on the call, chaired a meeting with the Integrated Care Board just last week, in which we were trying to imagine what future capabilities we needed. And data and analytics capability was absolutely front and center of almost everything that I heard that day. And that's because we know if we're going to make a difference to our population, we need a much better understanding of their needs. And we need to also understand the particular opportunities there are to address those in a much more systematic way. So I guess that is a fundamental culture shift from my point of view, in terms of thinking about how we use data to drive everything that we do to address inequalities, to think about how we improve care quality, and also how we create the conditions for innovation within our system. So this is massive. This isn't just about data for research, even though that is important. This is absolutely about an operating model for an integrated care system, which is why I think I've been so involved in the development of this work as we have gone along. That is going to require us to create new capability in our system. And one of the things we'll want to do, therefore, is to leverage some of the development opportunities we already have, to think about how we build a workforce that feels confident and competent using data much more systematically in everything that we do. And this slide really is calling out that opportunity to empower the workforce, so that at every level of our system, people feel able to use that data to inform what they do and how they can improve the care they provide. The final slide from me then is the next slide, which really, I think, again, is probably something that I feel particularly passionate about, and that is that it's not good enough, I suppose, just to ensure that our workforce have the insights that they need. We need to think about how we turn what we know into what we do. And very often we use data to understand the problem, but actually we increasingly need to understand that we need to create the capability in our system to then do something about it. So to turn insight into action. And that is a very underdeveloped muscle from my point of view in our system in South East London. And again, we do have capability that we can leverage, but we need to think about how we do that much more systematically, not just to develop data skills and data literacy, but as I say, the change and transformation capability that we need in the system. From my point of view, that is going to mean that we need to understand and implement a much more systematic use of data for improvement processes across the system. We've got great examples happening at this moment. Clinical Effectiveness South East London are a brilliant example, but we need to make sure that across all of our organisations and parts of our system, we're using data, as I say, much more systematically to improve care. We need to think about how it can inform more proactive care processes in the way that it did during the pandemic, where we were able to identify parts of our community where there was hesitancy around the vaccination and target our resources and our efforts much more effectively at increasing the uptake of COVID vaccination, or the way in which we understood people who were most vulnerable to COVID, those shielding populations, and we were able to target support to them. That kind of proactive care feels absolutely fundamental. And of course, how we then use that understanding to identify opportunities for innovation and change. That all requires new kinds of skills that we don't yet have in our system effectively around service redesign and transformation. So that for me is as critical as some of the data infrastructure we've been talking about. I hope that's helpful, just by way of describing that particular pillar of the transformation journey.
Thank you, Jonty. Jill, is there anyone else?
I think just to finish, Hitesh, and we'll share the slides with everybody after the session, but we've got a very heavy 2 years ahead of us. So looking at the next 6 months, 12 months and 2 years, you can see the work ahead of us, but then where this takes us through to that 5-year mark as well, and how we'll be drawing in the data, the staff and the learning. And just to echo Jonty's message, that this is the first time KHP and the South East London ICS have brought a blueprint of this nature together. but that opportunity to work at the heart of London in this and for London to grow and develop together, but based on the use cases that have been grown by the partners here, I think is absolutely fantastic. So back to you, Hitesh and Amanda, but thank you so much for inviting us.
You're welcome, and thank you for a very clear and on-time presentation. And congratulations on the SDE. I know that was a national competition, and I know I signed a letter a few weeks ago. So well done on getting that through as a competition against all of the UK.